Mr. Grove again. Hope everybody's doing well. Again, I reiterate that number one, if you need to retake a quiz or you need to, see a unit again, please notify me and by email, grovek@stevenscollege.edu, and I can accommodate that. Today we're going to look at burns, and we're going to kind of start things in a little different order. I'm going to ask you a few questions, what you know about burns, seeing that in some of your professional areas that you're majoring in. Could be a chemical burn, could be electrical burn, could be a thermal burn, could be a burn from radiation. So I'm going to ask a few questions and see how you would answer them, and then we're going to address those through this video, and hopefully by the end you understand what to do when there is a burn and how to handle the situation. So my first question, what would be the first step you would take when caring for an electrical burn? Now, I want you to think about this. Would it be check for life-threatening conditions? Make sure the scene is safe, the power source is turned off. Look for an entry and exit wound, and check for non-life-threatening conditions. Now, a few of those are good answers, obviously, but the first thing you would always do is make sure the scene is safe. You know, the check, call, care scenario. The scene needs to be safe and the power source turned off. You don't want to have somebody else be injured or the continuation or enhancing the injury itself with the power source still being on. So that will be addressed as this unit continues. My next question. Let's go to, let's see this one. You have a burn on your leg and foot area. Pain is excruciating, and it happened from, it sounds pretty scary, boiling water dropping onto your foot and leg. Okay? What do you do? And you think about this, you know, the pain could be pretty tough. If you can, get the leg under cold water as fast as possible. Flood it with cold water. That superficial wound burn is pretty intense and it hurts. So the cold water will alleviate that pain to some degree. So that's the first thing you would do if you can address it. If it's on your hand, it's very simple. If it's a burn on your hand from cooking or whatever, get it in the sink, get cold water running over it, and it might be 5, 10, 15 minutes. It may resolve itself after 5 minutes or so in regards to alleviating the pain. My next question, you spill a liquid corrosive product, chemical I should say, on your arm, or you spill it and it gets on your clothing. What do you think you should do first? Before you would flush the arm with water, before you would put sterilized dressing on it, before you would wipe the chemical off with a clean cloth, those type of things, the first thing you would do is have the person immediately remove the clothing. If it got into the clothing, if it's in their shirt, arm sleeve, whatever it may be, have the person immediately remove the clothing. Okay? And when a burn requires professional medical attention, you think about burns that cover more than one body part, burns that cause the person to have trouble breathing, you would call, and burns resulting from electricity, explosives, or other chemicals. You want to immediately get professional medical attention to those. So there are a few things to address. 4 sources of burns we're going to look at today are heat, which is thermal, electricity, electrical, chemical burns, and radiation. Here we go. Let me pull over that, and I'll reduce myself, and we're going to look at burns, and here we go.
Burns are a special kind of soft tissue injury. It's especially important to check the scene with burn emergencies, since the cause of the burn might still be active. Before you do anything, you need to make sure the scene is safe for you, any bystanders, and the injured person. Depending on the severity of the burn, a burn injury can damage the top layer of skin, as well as the layers of fat, muscles, and bone beneath. There are 3 different classifications for burn depth: superficial, partial thickness, and full thickness. A superficial burn only affects the top layer of skin, and while redness and dry skin can occur, these burns normally heal within a week. A partial thickness burn affects the top layers of skin, and, along with redness, can cause blisters and swelling. A full thickness may look charred or waxy and can be very painful, or, if nerve endings are destroyed, relatively painless. A full thickness burn may require medical care in order to heal. Burns are also classified into types: heat or thermal, chemical, electrical, and radiation. For heat or thermal and radiation burns, the key is to remove the injured area from the source of the burn. For larger, more intense wounds, call 911 or seek medical attention. For chemical burns, use a gloved hand or towel to brush it off into a safe container before flushing with running water under pressure. Flush the burn under tap water for at least 20 minutes, and have the person remove any clothing and jewelry from the burned area if it does not stick to the skin. If a chemical gets into the eye, flush it with water, positioning the affected eye lower than the unaffected eye to keep the chemical from moving from one eye to the other. Finally, call 911. It's always best to call 911 with a chemical burn. In the case of eye injury, flush the eye for at least 15 minutes or until EMS arrives. Remember, brush, flush, and call 911. Finally, electrical burns. Before giving care for electrical burns, make sure the person is no longer in contact with the electricity. Do not touch the person until the power is on. There may be entry and exit wounds, so look for those and provide appropriate care. Then, call 911 and get an AED if one is available. Be careful when cooling large burns, as you don't want to cause hypothermia. Cool for at least 10 minutes unless it causes the person discomfort. Then, cover the burn loosely with a sterile dressing, or, if one's not available, a clean dressing.
Okay, we're going to now go to the next part of the scene. And we're going to start the mission. Pull myself back down here.
Use the check, call, care process to respond to this emergency.
Check the scene.
Everything looks okay over here.
Okay, so now when I look over here, do you see the source that might have caused the injury?
Smart thinking. You've identified the flame as a hazard.
Everything looks good there. So this is the person in here. I don't think we're going to need to call 911 yet because of where the burn is located. So let's go right here. Let's obtain consent.
Yes, please help. Ah, jeez.
Okay, so when we obtain consent, let's interview her real quick.
I'd like to get my arm in the sink and start flushing the burn.
And we'll go down here.
Before you begin providing care, let's go over treatment for thermal burns. With a small burn, run the injured area under cold water for 10 to 20 minutes. With a large wound, stop the burn process and call 911. Using gloves, remove any jewelry or clothing that isn't stuck to the skin. Removing rings is especially important in case a hand swells. Make sure to leave any blisters intact and cover them loosely with sterile gauze.
Okay, so we said about cool the arm off with cool water.
Nice job. Now, while cooling the burn under the cold water, you can interview Annie.
Let's interview her. Sample. Okay.
Ah, it just hurts like crazy.
Okay, allergies.
No, never had any allergies.
Of course, medication.
None.
Okay, previous medical conditions, please.
None. Hey, the pain is starting to go away a little.
Good
I
answer.
think the water is helping. Thanks.
And the last food or drink?
I had a salad a few hours ago.
And what led up to the injury?
I wasn't being careful and burned my arm on the burner.
Nice job. You've gained enough information. And by the way, it looks like you missed a step or two along the way.
Okay, so let's
Did
look
you
at...
remember to check the scene and obtain consent?
Yep, we did. So when we look at this area, We want to cover the burn with a loose sterile gauze.
Good job. You've covered the burn with loose, sterile dressing.
Thanks for covering the burn.
Okay, you don't want to remove that. You want to keep that on.
Good job. You should continue to monitor Annie for any changes in her condition. In this situation, since the burn is relatively small, 911 does not need to be called. If the burn was on the hand, throat, feet, or genitals, 911 would need to be called immediately.
Okay, so let me enlarge myself here. Okay, so a couple things with burns. These are, as you know, all soft tissue injuries. Make sure if when you do cover with gauze, you do not remove the gauze. You leave it on. If it's oozing out or there's you see some more trauma there, you would reinforce it with more gauze. But do not remove the gauze. Some things about chemical burns. When you looked at the eye, make sure when you address, you pour away from the nose, so it would drain from the nose outward. Okay, from the nose. Okay, from here outward. So it wouldn't get into the other eye. Chemical burns or eye discomfort. Change in vision. Some of these things are when you do talk to the person. You know, it's probably always safe. Anything dealing with the eyes it talked about is call 911. Whatever type of burn. Electrical burns can be quite scary. Person can become unconscious, dazed, confused behavior. If a person goes into shock, as you know, you want to make them as comfortable as possible. Keep them out of harm's way. Keep them warm. You need a blanket possibly. And call 911. So, any questions? Again, if you need to retake a quiz, this quiz at the end of this video, the questions, if you paid attention, you'll know what they probably are. So there's going to be 4 questions or 5, and hopefully you do well. And I wish you a great midterm here. Friday the 22nd is when the midterm grades are due. Take care. I wish you the best. And recording as I still am. And we'll pause.